all you hear is hormone replacement therapy is bad, bad, bad. Is that true? Well, welcome. If you ever asked yourself whether hormone replacement therapy is right for you, or if you have been confused by the conflicting advice out there, you are in the right place. Today, we are going deep into what hormone therapy really is and what the latest research says and how to make informed decisions about your hormone health. Let's start at the beginning. Hormone replacement therapy, or HRT, is the medical use of hormones, most commonly estrogen, progesterone, and in some cases testosterone, to replace what your body is no longer producing in adequate amount. It's especially relevant during perimenopause and menopause, when hormone levels naturally decline. These declines are a normal part of aging, but for many, they come with disruptive symptoms like hot flashes, poor sleep, brain fog, low mood, thinning bones, or even a reduced quality of life. HRT aims to restore balance, stabilize symptoms, and enhance well-being, not just mask symptoms, but support your whole body in adjusting to this next phase of life. Think of it like refueling a car that's been running low. The goal is to keep your engine running smoothly, not to force it into overdrive. We will dive deep into how HRT works, who it's for, and how it can safely and powerfully use to support long-term health and vitality. Now, let's talk about the elephant in the room, the controversy surrounding hormone therapy. Back in 2002, a large study called the Women's Health Initiative, or WHI, made headlines. The study reported that hormone therapy increased risk of breast cancer, heart disease, and stroke. But here's what most people didn't hear. The average age of the women in the study was 63, well past the typical age of menopause, and many had underlying health conditions. The hormones used were synthetic and not individualized, and the media coverage caused widespread fear. This led to dramatic drop in HRT use, and unfortunately, many women were left suffering through symptoms without support. Fast forward to today, and we have a different understanding. Experts have reanalyzed the data and published new guidelines. Organizations like the North American Menopause Society, the Endocrine Society, and ACOG now state clearly that hormone therapy is safe and effective for many women, especially when started before age 60 or within 10 years of menopause. And when individualized to a woman's health need, this is called the timing hypothesis, and it's crucial. When started earlier, HRT may lower risk of heart disease, protect bone and brain health, and improve quality of life. So yes, there was a controversy, but it was based on misinterpreted data and generalizations. Today, we know better, and you deserve to know the truth. At practices at Thrivespan Elite, we don't recommend HRT for everyone, but when it's appropriate, it can dramatically reduce menopause symptoms, improve bone health, protect against cardiovascular decline, and enhance quality of life. So let's talk about the real-life, body-wide benefit of hormone replacement therapy beyond just hot flashes. For many women, HRT isn't just about comfort, it's about function and long-term health. First, HRT can dramatically reduce vasomotor symptoms like hot flashes and night sweats. These symptoms are more than inconvenient. They can disrupt sleep, concentration, and daily life. Second, estrogen plays a powerful role in sleep regulation. Many women report deeper, more restorative rest once their hormone levels are stabilized. Third, HRT supports emotional resilience and mental capacity. It can help reduce anxiety, irritability, and even protect against cognitive decline when used early in menopause. Fourth, hormone therapy has heart health benefits when started near menopause. Estrogen helps maintain healthy blood vessels and supports HDL cholesterol level. Fifth, it's a key player in bone protection. Estrogen slows bone loss and reduces the risk of fracture and osteoporosis. Sixth, HRT can restore vaginal health, improving lubrication, elasticity, and sexual comfort, which often improves intimacy and quality of life. Seventh, hormones like estrogen and testosterone supports muscle mass and metabolism, helping prevent the stubborn weight gain and fatigue that often hits midlife. And finally, estrogen plays a role in skin health, enhances collagen production, and maintaining moisture and elasticity. These benefits are not just anecdotal, they are well documented in medical literature. And when used correctly, HRT doesn't just treat symptoms, it helps you thrive through menopause and beyond. Risks vary based on age, health history, and the type of hormones used. Risks include slight increased risk of breast cancer with certain forms, blood clot if taken orally in some women, stroke risk if started later in life, but these risks are low for healthy women under the age of 60 or within 10 years of menopause. Some people experience side effects as they adjust, including breast tenderness, bloating, or mood shifts. These are usually temporary and can be managed by adjusting the dose or method, such as switching from oral to transdermal. Yes, you can absolutely take hormone replacement therapy after a hysterectomy. In fact, if your uterus was removed, you may only need estrogen and not progesterone, which simplifies things. HRT is not recommended if you have certain conditions like a history of hormone-sensitive cancer, active liver disease, or a history of blood clot or stroke. A full medical evaluation is essential to make the right call. Let's talk timing. Because when you start, hormone therapy makes a big difference. Experts now agree that the best time to begin HRT is within 10 years of your final menstrual period, usually between the age of 45 and 60. We call this the therapeutic window, the sweet spot where HRT provides the most symptom relief and the greatest protection for your brain, bones, heart, and overall health. Starting HRT during this time not only ease hot flashes, mood swings, and sleep issues, it may also help reduce your long-term risk of osteoporosis, dementia, and heart disease. But what happens if you wait too long? After age 60, especially if it's been more than 10 years since menopause, the risks of starting HRT can increase, particularly for women with underlying conditions like heart disease and stroke risks. That's not to say it's never an option after 60, but it requires more careful evaluation and should be highly personalized. So if you are in your mid 40s to mid 50s, this is your moment to have the conversation. Starting early may not just relieve symptoms, it may change your long-term health trajectory. Think of it like this: estrogen is protective shield. The sooner you restore that shield, the more benefits you lock in. There are no fixed rule. The old belief of 5 years max is outdated. Some people stay on HRT for decades as long as benefits outweighs the risks and your labs and symptoms are monitored. Long-term use is possible. The right dose is individualized. Signs your dose may be off include return of symptoms, side effects, or lab markers out of range. We adjust based on your body's feedback, not just lab numbers. Here is a question I hear all the time. Are bioidentical hormones really better? Let's break it down. Bioidentical hormones are chemically identical to the hormones your body naturally produces. Estrogen, progesterone, even testosterone, these versions are molecular twins of your own hormones. That means your body recognizes them, metabolizes them, and responds to them in a natural way. It's like giving your body exactly what it's used to, not an imitation. On the other hand, synthetic hormones, especially older forms like conjugated equine estrogen from horse's urine or medroxyprogesterone acetate, have different molecular structure. They can still bind to hormone receptors, but the fit is imperfect, and that imperfect fit is what can lead to unexpected side effects in some women. When bioidentical hormones are prescribed by knowledgeable clinicians, properly dosed and monitored regularly, they're both safe and effective. Now, to be clear, not all bioidentical hormones come from fancy compounding pharmacies. Many are FDA approved and commercially available, like micronized progesterone and estradiol patches. So the takeaway is this: it's not about natural or versus synthetic. It's about structural safety and smart supervision. When done right, bioidentical HRT can offer powerful symptom relief with a lower side effect burden, and growing evidence supports their role in long-term wellness. You can take HRT in different forms: pills, patches, gels, vaginal rings, or even pellets. The right method depends on your symptoms, lifestyle, and medical history. Transdermal methods tend to have fewer clotting risks. Let's talk labs, because a one-size-fits-all hormone plan just doesn't cut it. Before starting or adjusting HRT, it's critical to check your baseline hormone levels. That's how we personalize your therapy and ensure we're treating the root cause, not just chasing symptoms. So what do we typically look at? First up is estradiol, your main forms of estrogen. This tells us how much natural estrogen your body is still producing and helps guide your starting dose. Next, we look at progesterone, especially important if you still have your uterus, since adequate progesterone protects the uterine lining when using estrogen. We also assess testosterone. Yes, women need these too. It supports energy, libido, mental clarity, and muscle tone. Then there is SHBG, sex hormone binding globulin. This protein controls how much of your hormones are actually free and active in the body. High SHBG can mean your hormones are getting locked up and not doing their job. We may also check FSH or follicular stimulating hormone. While not perfect, FSH can help confirm menopause status when symptoms or cycles are unclear. And in some cases, we dig deeper, looking at your thyroid function, cortisol, or DHEA levels, especially if you are feeling chronically tired, anxious, or stressed out. Remember, hormones don't work in isolation. They're part of a complex orchestra. So understanding your full hormonal picture helps us support your body safely, effectively, and holistically. When these labs in hand, we can build a plan that's customized to your chemistry, not just based on average or guesswork. Most people notice improvement within weeks. By 3 months, major symptoms improve, and by 6 months, bone and brain benefits build. At 1 year, we reassess, is your quality of life better? Is it still worth it? Hormone replacement therapy can be life-changing, but it's not the only option. If you are not a candidate for HRT or simply prefer a more natural route, don't worry, we still have powerful tools to help you feel your best. First, we look at movement medicine. Regular strength training, walking, and yoga aren't just good for your body, they help regulate insulin, cortisol, and estrogen metabolism. Then comes nutrition. Certain foods act as phytoestrogens like flax seeds, soy, and lentils, gently mimicking estrogen in the body. Healthy fats like avocado, olive oil, and omega-3s also support hormone production and reduce inflammation. Next, we tap into adaptogenic herbs like natural compounds that helps the body adapt to stress and support hormonal resilience. Things like ashwagandha, rhodiola, maca root, and vitex have shown promise for improving energy, sleep, and cycle regularity. And finally, never underestimate the power of mind-body medicine. Quality sleep, deep breathing, mindfulness, and nervous system regulation all play a role in restoring hormonal harmony. These alternatives can be used alone or alongside HRT, depending on your symptoms and goals. The key is working with a practitioner who understands how to match the right strategy to the right body. So whether it's hormones, herbs, or holistic care, you have options, and we will help you choose the best plan forward. Let's bring it all together. Hormone replacement therapy is not a one-size-fits-all solution, and it shouldn't be. But here's the truth. When used correctly, with the right person, at the right time, and with the right support, it's personalized, tailored to your body, your symptoms, and your health history. It's effective, relieving hot flashes, restoring sleep, boosting mood, brain function, libido, and bone strength. It's safe when it's started close to menopause with proper screening and monitoring. And most importantly, it can be transformational. This isn't just about managing symptoms, it's about helping you thrive again. Whether you choose HRT or alternative strategies, the key is understanding your options and being guided by evidence, not fear. Your hormones don't have to define you, but with the right support, they can absolutely empower you. You deserve to feel vibrant, sharp, and fully alive, no matter your age. If you are ready to explore whether HRT could support your energy, clarity, and long-term health, book your personalized review with us today. You deserve a care plan as unique as you are.
Please don't forget to like, comment, share, and subscribe.